Welcome to Deuk Spine Institute, live spine surgery. Our patient travels to Florida from Bali, and he has 2 bad discs. Is he doing all right? Yep. He is snoozing. I can hear him snoring. And he's had back surgery before. He had a microdiscectomy done. Not here, obviously, somewhere else. He does? All right. Long story short, he has developed back pain over the years, and, well, we did an MRI review, and his disc is collapsing at 5-1, and it's not the fact the disc is collapsing that's the problem. It's the fact that he has a disc problem at 5-1. He also has a disc problem at 4-5. Shot? And we're going to try to fix both discs today. That's what I expect to be able to do. Shot? Shot? Just can't get south. Shot? Shot? He is snoring. All right, if you have questions, feel free to ask us. Meanwhile, I'm going to try to get into 5-1. 5-1 is always the hardest disc to get to. And I can tell you right now, this patient is not making it easy for me. His 5-1 is pretty deep. Doesn't mean I'm giving up. It just means that it's not easy. Now, he's had back pain for how long? 10 years. 10 years. Shot? Go ahead, Luis, you can numb and shot. Folks, he's had, thank you, Nikki, lower back pain 10 plus years. And when I asked him, where is your back pain? He told me it's right in this area here. Well, what's here? You got some facet joints, and his facet joints were not tender, I don't think, right? They were not. And then you have these 2 discs, L5-S1, L4-5. And, you know, look at the MRI, it's kind of a no-brainer. It's the L4-5 and L5-S1 disc causing his pain. So he came here and we're doing his surgery. He didn't want fusion. Shot?
Hello, sir.
This is going to be the part where he is the most uncomfortable as we get down to the painful disc. AP, let's just make 100% sure. So we've lost 1 drop of blood. You guys can see that. And hopefully that's all we're going to lose. Yep. So his spine is very far forward. Unusually far. Unusually far forward. Any questions?
Yes, actually. We have a question coming from Brad on YouTube.
Hello, Brad. Welcome.
Asking, are there any new emerging technologies in the realm of spine and pain to look out for in the future that you know of?
Yes. The Deuk plasma rhizotomy. That's what we're doing right here. And Deuk piriformis release. That's what we're doing right here at Deuk Spine. Those are your new emerging technologies. I am amazed at how deep his spine is. He's a thin guy, very shapely. It just goes to show that when it comes to where your spine is in your body, it has nothing to do with how fat you are or skinny you are. It has everything to do with genetics, what you're born with. And he's born with a spine that's just really far anterior.
Keep your head still, sir. You're moving your head too much. Can you keep
Don't move.
Don't
Num
move.
num num.
Don't move.
All right. Yeah. There's honestly, most of spine is degenerative. About 95%. About 5% is trauma, tumor, infection, deformity, which is your, pediatric or juvenile scoliosis. But the vast majority of spine is degenerative, which is exactly what we fix here at Deuk Spine. And the technologies I've told you about, Deuk Piriformis release shot and Deuk laser disc repair, those are the big things. Shot? In my opinion. Okay? That's the future of spine care. Yeah, I am really amazed at how far forward his spine is. And you would never expect it to be so far forward and such a thin guy. Don't move! Shot. So the reason he's still awake is I need his help right now getting down to his disc. Shot. That's pretty good right there. And as soon as I get in the discs, I'm going to keep him awake for a moment while I test the discs. AP. And then I'm going to put him to sleep while we do the surgery. But I need him awake, and I do that for everybody. I need their help in the beginning of the surgery. Coker. Perfect. Now that 5-1 is a little concerning. It's a little lateral, but that was the best I could do. Shot? Yeah, it's a bit lateral. I have to be careful there. All right, shot. We're going to get into 4-5. Is he awake? Reliable?
How you doing, my friend? You okay? All right, we're going to ask you a question. Thanks for staying still. Lay still.
All right, we're going to check the 5-1 because on the AP it looks like the needle is lateral in the disc. I got to see if we're even in the disc. Because the spine is so far forward that for me to get into the disc, it's a real reach. I mean, you can see the 5-1 needle is all the way to the hilt. And that is it's very unusual for somebody with his build to take the whole needle. Normally it's a lot shorter. You comfy? Any pain?
Having any pain right now? No.
All right. Let's see where 5-1 is. Shot? I do feel disc. We're in. How bad is that on a scale of 1 to 10?
Give us a number.
What's the highest?
10.
10. Is that where you get pain? 10 out of 10 at L5-S1. Okay, I could feel his body tense up. Clearly a painful disc, so I'm glad we're fixing it. Shot? What happened, Jordan? All right. We're going to put you to sleep in just a moment. So good news, L5-S1 disc with a tear, MRI, abnormal disc. It's causing 10 out of 10 pain. So we're going to fix that. You okay?
Yeah.
You said yeah. How bad is that on a scale of 1 to 10? 10. That's your L4-5, by the way. Both discs were the same. 10 out of 10 concordant. That's where you get pain, right? Yeah. All right, good. So we just verified that his back pain is coming from 2 discs, L4-5, L5-S1, and it's coming from the tear in the back of the disc. On the right side, based on his MRI, we're going to go fix it now. We're going to put him to sleep. My anesthesiologist is giving him medicine to put him to sleep. Take your time. No rush. Meanwhile, I'm going to give him some more numbing medicine to make him more comfortable. Shot? All right, so we want to start at 5-1? I don't want to start at 5-1. Let's start at 4-5. Yeah, I like to have everything out of the way to get to 5-1. Any questions, Henry?
At this moment, no current questions. So in the meantime, why don't we
Shot.
show the audience of the 30 causes of back pain?
I think it's a great idea because there are 30 very common causes of chronic back pain, and some of them are far more common than others. Like the most common is the L4-5 disc, and that's exactly what this patient has. It's also what the last patient had, and the one before. Yeah, we're giving you some medicine. Just lay still. You're doing great. I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us.
Welcome back. I'm Dr. Deuk Majin. We're at Deuk Spine Institute, and we are performing the Deuk laser disc repair for a patient with back pain who has a herniated disc at L4-5, L5-S1. This is the L4-5 disc. It was a 10/10 pain. That's the horrible pain. 10 out of 10 is like somebody ripping your arm off without anesthesia. It's horrible pain. And he told us when he felt us inject this disc, it was 10 out of 10. And it was concordant, meaning that's the pain he always gets. All right. So far, while you guys were watching that nice video on the 30 causes of back pain, I've been cleaning out this disc, cleaning out the herniation and tear, and we've been making some good progress. Look at the inflammatory tissue, the pink stuff right there. Shouldn't be there. That is where his pain is coming from. That's going to be gone when we're done. Any questions from our audience?
Yes, we have a question and a comment. Starting with the comment coming from Ali on Facebook, just mentioning about the last video, saying, love this new video explanation. And so thank you, Ali.
You're welcome. Yeah, that's awesome. Oh, so she likes the 30 causes of back pain.
Yes, yes.
Oh,
we got multiple compliments towards that video,
Oh,
and
good.
I'm very.
Yeah, that's awesome.
It means a lot to me.
Yeah, we want people to understand there's more than one thing that causes back pain, and what are those things, and how common are they? So appreciate it. We spent a lot of time on that video building it. Henry and I and Tambeen.
Yes. And we should have the 30 chronics of neck pain coming out next week.
Yeah.
So this next question is coming from George on YouTube.
All right, George, be happy to take your question.
Saying, hello, doctor. How do you treat or have you treated spine central stenosis without a herniated disc with thick ligamentum flavum and facet joints hypertrophy?
Hi, George. Thanks for asking. Yes, there's no such thing as spinal stenosis without a herniated disc. And if you've seen it, send it to me. I would love to see it. I've never seen it in my entire career. Yes, the ligaments can get thick, and yes, the facets can get enlarged, but the disc must be injured to get spinal stenosis that is acquired. It's not possible otherwise, unless you have a tumor or a fracture or an infection. So, not sure what planet you're from, but on Earth, human beings always have a herniated disc with spinal stenosis.
We do have a question that is coming up. Unfortunately, this is coming from Izod, who says, hi, doc, but it's I think they're about to leave a question in a moment.
Hi, Izod. Welcome to our live stream. All right, while we're waiting for Izod's question, I'm going to show you guys. This is the tear in the back of the disc. And that at 12 o'clock position is fat and a little bit of blood vessels. And we just got to finish cleaning this. We'll be done with L4-5. You see the blue stuff is the herniation. There should not be blue stained disc. That means it's degenerated.
Oh, we just got the question from Izod on YouTube asking, do you treat osteophytes in cervicals?
Do I treat osteophytes in cervical? Absolutely, Izod. This laser can melt steel. It can easily remove osteophytes. We do it all the time. And we do it in the cervical spine. Now, we did a surgery earlier today. If you go back and watch the first surgery of the day, a patient from Hawaii, from Maui, who came here, he had 2 disc herniations in the cervical spine, and one of them had some bone spurs, and you can see the laser removing the bone spurs during the surgery. They were not very big, but you could still see the laser removing them. Great question. Thank you, Izon.
At this moment, no current questions. So in the meantime, let's show the audience of why is it they get lower back pain to begin with.
Yeah, what causes, when the disc is the cause, called discogenic lower back pain.
Correct.
How does that work? How does a disc injury cause lower back pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
All right, welcome back. You can see from our video that the Deuk laser that disc pain comes from a tear in the back of the disc. And we are literally in that tear right now. And this blue stuff right here, this kind of what I'm zapping with the laser, that is herniation. Now this right here is ligament called posterior longitudinal ligament. That's fat behind the ligament. The more I clean out this tear, the faster and better it will heal. And so far we're done a good job. I'm just about finished here. There's a few pieces of calcium or osteophyte that I'm removing, and we're going to be done. I can tell you this injury to this disc goes back quite a bit. It looks like it's around 10 to 15 years old. Any other questions?
At this moment, there are no current questions, so in the meantime, let's show the audience of how the Deuk laser disc repair actually works.
I think it's a great idea. Splendid.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from the video that the laser cleans the tear in the back of the disc where the herniation is. That's exactly what I'm doing right now as we speak. You see the gold color is calcium, or the beginnings of osteophytes, which are made out of calcium. And the blue is the nucleus stained. The laser fiber is 1 millimeter wide, just to give you a perspective on how big things are. And we're pretty much done here, okay? I've done a good job cleaning it out. I want you to see how big the tear is now that we have cleaned the herniation out of it. The herniation is gone. And remember, the laser fiber is 1 millimeter, so it's about 3 millimeters wide. It was 6 or 7 millimeters wide before, and now it's about 3 millimeters wide. So that 3 millimeter wide defect will heal on its own. His body will heal it now. Now it can heal it, because before he couldn't heal it. He had the herniation in there, blocking it from healing, which is why there's pain, as you saw in the video. Any questions?
Yes, we have a question coming from Essential Advantages on YouTube.
I like that name, Essential Advantages.
As do I.
Thanks for joining us.
They said, hello, how
Hello.
soon should someone wait before rebounding on a trampoline after a DPR and or DLDR?
Great question, Essential Advantages. So DLDR, this surgery where we fix the disc, I would not do trampoline for 6 months. 6 months would be my recommendation. Now DPR for facet joints or SI joint, you can do it a week after surgery. The DPR is totally different than the DLDR. The DPR, we're just going in and cutting pain nerves to the joint. So you can go back to normal activities right away. With the Deuk laser disc repair, there's still that defect. We call it a defect that, you know, the tear, I cleaned the tear, but it's still separated by 3 millimeters. And, And basically, that defect is not going to heal if you re-herniate, if you get another piece of herniation coming out. So if you go on the trampoline too early, you can push another piece of herniation out quickly, and then it'll get stuck in there, and then the tear will never heal. So I would not advise trampoline for 6 months. And if I had my choice, I would do 1 year. But my advice would be 1 year if it's just for fun. But if you work for Cirque du Soleil, maybe 6 months, because you need to get back to work. Just so you all understand, when it comes to restrictions and surgeries and things, it's all about what's called probability or risk. And if you have the Deuk laser disc repair, say you have 1 disc. Well, if you go on the trampoline 6 months after surgery, the chance that you're going to injure that 1 disc is not great. It's not very high. If you go on the trampoline, maybe 5%. But if you had 2 discs that were repaired, it's going to be higher, maybe 8%, 10%. If you have 3 discs that were repaired, then it's even higher, right? So depending on how many discs you're having repaired is gonna change your risk stratification. So my advice is always be cautious. If you're going to spend the money and time to have this surgery done, then, you know, just be patient, get healed properly. You don't want to have to come back. Shot? Okay, this is just so difficult here. 5-1. Yeah. And it's because of his spine is so far in. So far in. And what do I mean by that? Well, your spine is either going to be close to your back, your skin on your back, or close to the skin on your belly, or somewhere in between. His is close to the skin on his belly, which makes it really, really far from the back. Which makes it really hard for me because my instruments have to go all the way down there. And these instruments are made a certain length. They're manufactured for the average plus or minus probably 3 standards of deviation. But some people are exceptional. He's not. If he was fat, it would be impossible to get his back fixed. He's not. He's very, very much in shape. Thank God. All right, any other questions?
Yes, another question coming from Essential Advantages, once more on YouTube.
Sure.
Afterwards.
Yeah, you can get chiropractic adjustments after the Deuk plasma rhizotomy if you want to. Grab her. Right away, usually within a week or 2. For the Deuk laser disc repair, I would not recommend chiropractic adjustments within the first 6 months to a year. And again, everybody's a little bit different. Some people 6 months, some people a year. All right, look at how damaged this disc is here. It's extremely collapsed, but it's really scarred. And that means that this has been a problem for him for a long time. I don't think he's that old. Is he in his 30s?
38.
Yeah, he's in his 30s. So this disc injury right here, 5-1, this is like 20 years old. It must have happened when he was a teenager. Everything okay, guys? We got about 2 minutes left, Dr. B. Look at all the pink stuff. That's inflammatory tissue. So what's happening here is there's so much inflammation in the back of this disc from the tear, getting the herniation stuck in it, that inflammation has been going on for so many years, like 20 years, 50, that the inflammation tissue has grown, like literally tiny, tiny microscopic bit every year, deeper and deeper and deeper into the disc, from the outside to the inside, from the outside of the wall to the inside. And you all right? You want to talk about it? Oh. You partying a little too hard, Nikki? So, if you look carefully at some of these older disc injuries, spondylitic disc, where the disc is more collapsed, the injury's been around for a lot longer. You can see the ingrowth of granulation tissue, scar tissue, deeper and deeper and deeper. There's a bone spur. Goodbye. And that's what we're seeing in his case. Oh, look at that inflammatory tissue right there. So pretty. I love the colors. Blue, white, gold, red. All right, what university has blue, white, gold, and red? Anyone? Want to venture a guess? No? All right. I don't know either. I'm asking. Henry?
I was going to say American University?
I don't know.
Oh, in general?
I need you to tell me.
I will look that up. In the meantime, we do have a question
Yes.
coming from Izod, once more on YouTube,
Let's do it, Izod.
saying, osteophyte is causing the calsec indentation in a budding right exiting nerve root at C4 and C5. Same happening at C5 and C6 with a budding bilateral exiting nerve root, central disc mild at C6, C7. Do
Yes.
I need this treatment?
So, Izod, first of all, you got to learn something about Deuk Spine Institute. We read our own MRIs. We appreciate the fact you have a radiologist who did yours and read it, but we don't trust their read. Okay? Would you trust somebody who told you there's no sharks in the water that you're about to swim in? Somebody who you don't even know who they are? The answer is no. You want to know for sure there's no sharks in the water. So you'd stick a GoPro under the water and verify that. Okay? You're going to do your own test. You're going to look yourself. We don't trust other radiologists' opinions. So we're not going to trust that report. I'm not going to trust that report. Now, let's pretend for one moment that that report was correct, which I don't think it is, by the way. But let's say it's right. There's just a bone spur, nothing else, no herniation. Then this laser surgery would not be the right surgery. But there's only one condition where there's pure bone spur and no disc herniation, and it's called OPLL. It stands for ossification of the posterior longitudinal ligament. And I'm not hearing that in your report. So I think your radiologist that read that is wrong. I'm not sure why they read it that way, but it sounds like they're trying to convince you to have surgery like an ACDF. Sounds like the radiologist is in cahoots with the surgeon. That would be my number one guess. If I were you, I would get a second opinion. We offer a free MRI review with me. You get to meet me face to face, and I will tell you what I think's wrong. Now, if I think you have just a bone spur, I'm going to order a CAT scan. The CAT scan is the only test in the world that will tell you if it's a bone spur. MRI is not going to tell you if it's a bone spur. The CAT scan is the only test in the world that will tell you if it's a bone spur. You can also get an X-ray, but the X-ray is not very good. It's not reliable. So my advice to you is get a second opinion. but you're also going to need a CT scan of your cervical spine. All right, my friends. Henry, you put up the link for the free MRI review
Of course, yes.
for Izod so he can come and see us.
Yes.
But we are done with this patient from Bali who came to Florida to get his back fixed. Nice young man. And everything went really well. So, yep, all done. Cleaned him out. This is the 5-1. You can see how much worse it is than the 4-5 was. All right. How is he, Dr. B? Ready to wake up? Yep. All right, let me just get this last little piece. Any other questions while I'm doing this last piece?
At this moment, no current questions, but to answer your the red, white, and blue for colleges, the only one that I can see was UNC at Chapel Hill.
Ah,
Yeah. That was the only one that I
That's
found that
their
has like
red.
all colors.
UNC Chapel Hill does not have red. We have a dispute here. Dr. Davis says UNC Chapel Hill does not have red.
No, you're right. You're right. I was trying. Like there was text that said that it was in red, but it's not actually. University of Arizona.
Arizona,
Yes.
party school. Party school. All right, guys, there's the nerve right there. You guys see that white? That is the nerve root. That's how close we are to the nerve. And there's the tear. Look how quick that's going to seal up. Got lots of fat. Beautiful. Beautiful. All right, great questions. If you have any more, type them up in the next 30 seconds.
No current questions, but we do have a comment coming from Paulos on YouTube saying,
Paulos.
"Keep up the great work." Oh, and we just got a question from Rush on YouTube.
Rush?
Rush, like the band.
R-U-S-H.
Yes.
There is no band Rush. It's. Oh, yeah, sorry.
Yeah,
There
the
is a
band
band
Rush.
Rush. I apologize. I apologize.
All good. All good.
Tom Sawyer.
Yes, exactly. Yes.
One of my favorite songs.
Exactly. That got me into
I
drums.
apologize. Yes, there is Rush.
All is-
Moving Pictures is the name of the album.
Yes, correct.
Great band.
Great band.
If that's who they're referring to.
Yes, exactly. We do have a couple more questions coming up.
All
so
right,
we'll
save the
yep.
questions. I'm going to come and answer them face to face, so I get to see your pretty faces.
Copy that.
Scopius is a 7.
Hey, good morning. I'm Dr. R. Deuk Machen, CEO and founder of the Deuk Spine and Deuk Joint Institute. I'm here with a patient who's traveled from Pittsburgh to Florida. And what brought you here to the Deuk Spine Institute?
Well, I have had back pain for so long, and anything and everything we did didn't help. My wife did significant research. We found you online, actually, is how it started.
Excellent. And what kind of procedures did you have done before you came to Deuk Spine?
I've had 5 lower back surgeries, 1 fuse, and the others laminectomies and so on, all within the last 3 years.
And they were recommending another fusion for you, weren't they?
They were. That's when I really began to research other options. When they mentioned another fusing, I absolutely was not going to do that. So that began a research that ended up finding you.
The Deuk Spine Institute. And what we do differently, folks, is we cure pain with one procedure. Patients don't have to keep coming back having multiple procedures and pain management. And that's kind of where you were. You were in that surgery, pain management, surgery, pain management, surgery, pain management, back and forth. And that goes on if you keep doing it for the rest of your life. But you found a way to get out of pain and you came to Deuk Spine. How do you feel today?
Unbelievable. I have not felt this good in years, several years.
And you feeling good because we put you on some new pain pill that nobody else has?
Absolutely not. I've lived on pain pills up to this point. I'm on nothing. I have a prescription for some muscle relaxers, no pain pills, and I'm on nothing.
And how did Deuk Spine Institute fix your back?
Had the L4-L5 laser surgery, and then the rhizotomy that was done a few days later. A combination of those two, I'm pain-free.
Yeah.
I'm really pain-free.
I'd just like to point out that you, like many people, had more than one source to your back pain. You had discs that were causing the back pain, facet joints that were causing the back pain, sacroiliac joints that were causing the back pain, I think a piriformis that was causing the back pain. And because you were walking so funny, you were getting bursitis and other pain in your leg from the iliotibial band. We had to identify every one of those sources and treat everyone properly. And once that was done, it eliminates the pain permanently.
I have dreamt of feeling this way for years. Teared up a little bit this morning when I woke up. I could get out of bed without holding on to the wall, or it was just an incredible feeling.
Well, I'm very happy for you, and you could see we did your surgery with the laser, cleaning out your discs. Where did you go for your spine care? Was it a good center?
Prior to coming here,
Yeah.
I was at 2 major medical facilities in Western Pennsylvania and Eastern Ohio. Went through a lot of pain, a lot with the different procedures and surgeries I had done, and had no relief.
And what were these other facilities, you can say?
UPMC and Cleveland Clinic.
Yeah, 2 of the top spine institutions in the world, right?
Yes.
Great reputation,
Yes.
and yet they couldn't get you out of pain.
No.
And they were just ping-ponging you between surgery and pain management, surgery and pain
That's
management.
exactly what happened. Yes.
And there's no hope for actually getting cured because they don't have the cure to back pain. We do. Unfortunately, we've been trying to share that cure with them, but they're not interested. They just want to keep doing fusions because, well, let's say it, fusions make a lot more money than laser surgery does. It's hundreds of thousands, if not millions of dollars over your lifetime. That said, I'm glad you're doing well. When are you guys heading home?
Getting on a plane in a couple hours.
All right, very good. Is there anything you want to tell people out there in final remark?
I would just say that Deuk Spine Institute has been a lifesaver for me, literally. I would highly recommend it. I was being ping-ponged around for 5 years. I have dreamt of feeling like I feel right now for a very long time. So I cannot thank you, Dr. Patel, your entire staff. Everybody's been just incredible.
That's what we're here for, my friend.
Thank you, Doctor.
Give people back their lives.
Yes, thank you, sir.
All right, now go enjoy your Top Golf.
I will now. I will now.
All right, let's get you out of here.
It is a great day. I'm actually had an opportunity to meet one of my fans on YouTube who has been following our surgeries for a long time and asked incredibly intelligent and insightful questions about spine care. Made the decision to come here with his wife from Phoenix to actually get his back fixed the right way. And I'll let him tell you a little bit about it. Do you mind sharing your story about your lower back?
Not at all. I mean, it's a long story, but no, I don't mind. Originally, I'm an Army veteran, originally hurt my back in the Army, continued to herniate and have disc treatments. I had a discectomy in 2008, scar tissue built up after that, then went to a spinal stimulator in 2013, went to another spinal stimulator in 2016. I've had every back lower lumbar procedure you could think of. I've had medial branch blocks, I've had an RFA, bilateral RFA, I've had all sorts of treatments.
Did they work?
Epidurals. No, I'm here, right? It was constantly hurting to the point where this last year, since the start of 2020, bad leg weakness, the shooting pains in my lower back. I couldn't walk for more than 50 feet anymore. And I'm like, I just turned 50 last week. This is going to be a problem for a number of years more. So I had to find something that was going to solve the source of the pain and not just treat the symptoms, because there's nothing left to treat the symptoms besides a fusion.
And you were skeptical because
Right.
you've been through so much treatment. None of it really worked, but you found our site.
Right.
You engaged with me many times on the internet while I'm operating.
Right, absolutely. Which made the pre-op appointment go so quick, though, because I'd asked all my questions.
True.
So that helped. It definitely helped.
So what made you decide to come to Deuk Spine Institute?
Just so I can annoy everybody around me again, because I'm no longer going to be in pain. That's a good thing. Like really, I can do things with my family again. So that's
Yes,
really
you
good.
can. So you had your surgery done yesterday, less than 24 hours ago.
Absolutely.
Here you are, pain-free.
Yes.
Did you expect that?
I've seen other testimonials, so I knew it was possible, right? But I'm like, no, there's no way. Oh yeah, pain-free.
Do we have you on morphine and
No.
oxycodones and any
No.
pain medications?
You gave me
like-
the 9 Robaxin, I took 1, and
Yeah.
that was last night before I went to bed, and no, nothing else.
Robaxin's a muscle relaxer. It lasts 6 hours, so it's already out of your system. So no pain meds.
No.
You're here walking around, outpatient surgery.
Yes. Yeah.
done with a little cut on your back. You can actually watch it here. You can see some footage of where we went in with a tiny little incision, brought the endoscope in, we brought the laser in, we cleaned out those tears where the herniation was, where all your inflammation was. You can even see a little bit of pink tissue in there, inflammatory tissue. That's where all the little nerve fibers are that cause so much pain in the back of the disc. We got rid of it all, and that pain is going to be gone permanently.
I'm looking forward to it.
Anything you want to tell your fans out there?
I'm just happy to be, really, I am pain-free. Like, I'm annoying my wife because I have limitations, obviously. I'm not supposed to lift and all that. But I have no pain, so I'm literally bouncing off the walls now, which of course everyone has cautioned me not to do. But really, that's it. Is like, I'm excited. Winter's coming, things to do. I'm not going to be suffering
Not
as
too much.
No, but I won't be suffering from the cold anymore. I won't be one of those like, oh, it's going to be cold outside. I can't move. I'm happy just to think about that. So yeah.
Obviously, you can tell from his energy level, he's not the kind of person to take it easy. So, but I know he's going to follow the instructions. His back will heal beautifully. I do want to point out one last thing. If you go back to the video footage, you can actually see he wrote on his back, like, have a nice day or have a great day.
Yeah, make it a great day, yeah.
Make it a great day with a big smiley face. So he's the first patient that did that, and it really put a smile on all of our faces while we're operating. So thank you very much.
Absolutely.
Appreciate it.
Really, thank you very
for your
much.
involvement. You're welcome. Yeah. Enjoy life.
I'm gonna.
All right. Let's get you guys out of here. You got better things to do.
We're here at the Deuk Spine Institute. I have a patient who traveled from Ohio to Deuk Spine Institute for his lower back. And he's been through a lot of treatments in the past that didn't really work. They may have given him some temporary results. I'll let him tell you more about that. But he's here today, a new man, just 24 hours after his outpatient surgery. He had the Deuk laser disc repair. You can see in the video we made some small cuts on his back, went in through a natural opening in the spine called the neuroforamen. We didn't do any damage under the skin, and we were able to repair the herniations that have been plaguing him now for years. How long have you had problems with your back?
Since approximately 2009, quite a while.
All right, so about, what, 14 years now?
Yeah.
And you've had surgery before. How were those other surgeries?
I had two minor surgeries. One lasted for about, relieved my pains for 3 years. Second one, maybe 6 or 7, somewhat of the pain, enough to get me through. Over the last couple of years, the loss of balance, which really affected my job, was just getting worse and worse and worse. I really didn't know what to do. And I went through 3 local surgeons, and everybody, the only answer was fusion, fusion, fusion. That was pretty much going to end my career. So
yeah,
I found this guy.
And you had surgery yesterday. How are you feeling today?
Besides just a little bit of soreness in my back, the balance is back. I know I'm on a way to recovery.
You look a little teared up there. Yeah? It's been a journey, hasn't it?
As soon as I did the video conference with you, I sort of broke down like this too, just hoping
I understand.
they'd be back.
So can you tell the difference at this point, now that you've had the surgery?
Oh yeah.
Yeah?
Yeah.
You said you got up and you walked straight this
That's,
morning.
I haven't been able to do that for over a year without falling. I couldn't walk down a hallway without
Yeah.
grabbing the walls.
And the reason for that, your nerves were getting pinched pretty bad. And we went in there and unpinched them during your surgery with the laser. And we did not have to do a fusion, and you're not going to need a fusion. That's the great news.
Yes, it is.
And is there anything else you want to tell your fans out there?
I just hope more people that these doctors want to give them that option, fusion. Come see this guy and don't ruin your life.
When do you head back?
Sunday.
Sunday. You're going to enjoy Orlando for a little
I'm
longer?
gonna try, yep.
Yeah, all right. We'll try to make it out to the Space Coast and go see the rockets over at the Kennedy Space Center. It's pretty cool over there.
Okay.
All right, sir.
Thank you, sir.
You're welcome. My pleasure. Let's get you guys out of here. Come on. I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day. I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's going to be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to. No, excruciating pain. I mean, can't sleep, awake all night. The pain was constant. It never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max, and 2 hours was a gift, and that's all night.
Oh, hi there. I'm sorry we had to interrupt the testimonial, but you saw a couple, and I'm back. I had a chance to visit with my post-op patients in the recovery area, and we didn't show you a piriformis release on a soon-to-be professional baseball player, pitcher, as a matter of fact. Can't give you any information about him other than he's doing fantastic. And the other patient was a ex-federal agent who retired, and we just fixed his back. We did a disc above and a disc below his fusion and his sacroiliac joints, and he's doing fantastic. So he was asking when he can go fishing. And I'm like, I love that. What do you catch? And he showed me a giant drum. Oh, it must have been a 40-pound fish. It was huge. So anyway, everybody's doing good. The last case we just finished here, a patient from Bali, and his 2 discs were very painful. We tested them at the beginning when we did the discogram, and he is in recovery now. He's doing fine. So we have some questions. I'll be happy to answer them. If you have other questions, type them up quick. We do have one more surgery today. That is going to be a patient with a L5-S1 disc herniation with back pain. We call it discogenic back pain. Disco means it's coming from the disc versus facetogenic, which is coming from the facet. Genesis is to create the origin, Genesis, the first book of the Bible. So Genesis is the beginning or origin or source. So discogenic means from the disc, facetogenic means from the facet joint. Sacroiliac jointogenic would be from the sacroiliac joint. I just made that one up. But basically, the next patient has pain from her piriformis. We're going to do a piriformis release on the right, and she has L5-S1 discogenic pain. So we're going to start with the discogenic pain and do the laser surgery. We're going to end the broadcast and resume for the piriformis, and you guys can watch those. Piriformis goes quick. Pay attention. It's basically, I'll show you. So what you are not seeing on this model, this is the hip, this is the femur, this is the top of the femur here. The piriformis muscle runs from here to here like a fan-shaped muscle. I release it right off the top of the hip. It's a technique that I developed and pioneered, and it's minimally invasive, it's very effective, and it's very safe. So that's what we'll be doing today. Any questions?
Yes, we got a good amount. This next one coming from Rush, love the name, on YouTube.
Is it the band?
I want it to be.
Yeah. Well, Rush, I hope your mom and dad didn't name you Rush.
Yeah.
Rush, get to the hospital. He's coming out.
We gotta rush.
Right.
They asked, hi there. I'm seeing a bunch of gold. Is the calcium deposits beneficial or damaging to the disc?
Yeah, Rush, great question. Great question. Nobody knows. I don't know. If I don't know something, I'll tell you I don't know. I honestly don't know. Calcium in the disc like that is only happens when there's, so let me back up. The process is called dystrophic calcification. It's widely known, dystrophic calcification. It's been widely known for 100 years, 200 years. Doctors have known about it. If you get damage to certain organs, livers, kidneys, muscles, discs, then that damage creates inflammation, and that inflammation brings in scar tissue, but also for some reason calcium attaches to that area, like it binds to it. I don't know why. No, I don't know if anybody knows why, but I don't know if it's beneficial or damaging. I really don't. It's just an observation that it's there. We just see it there, but we don't know what it's doing there. We don't know if it's helping or hurting, but yeah. So that's the best I can answer the question.
Next question coming from Essential Advantages, once more on YouTube.
Hi there.
Asking, I see you use staples at the end. How do they get removed then?
Great question. Excuse me. So the staples we take out the next morning when the patient comes in. All of our patients are discharged within an hour of their surgery. So all these people you watch have surgery, they all go to recovery in our center, and then they wake up. Once they're awake, they go back to their hotel or home, and they come back the next morning for a quick checkup. We look at the wound, make sure everything looks good, but we take the staples out, we put steri-strips there. We used to just put steri-strips in the operating room, no staples, which is fine. But what happens is they go home and they have a little bit of oozing of blood that comes out because the steri-strip doesn't hold the skin edges together that well. So they get a few drops of blood on that steri-strip, that little bandage, and then the bandage detaches, it comes off. Once you get a little bit of blood on it, it just comes off the skin because it's only sticking to the skin like a piece of tape. So we decided that that just wasn't enough right after surgery, because you got basically you're doing surgery passing through a muscle, and muscles are very vascular. They have a lot of blood supply, so they ooze a little bit afterwards, and the steri-strips were just coming off, so we decided to put a staple. It was actually Luis's idea, and he was right. It works. So we started doing staples about a year ago, probably, and the patients come in anyway the next day, and we just change it out. So, yeah, next day.
Next question coming from, love the name, Terminator T850 the Fearless.
That's awesome. We love Terminator.
I love that.
Greatest movie. One of the best movies
Honestly,
ever.
Yeah.
Oh,
Terminator
man.
is one of my favorites. They asked, I have a 4mm central L5-S1 disc protrusion toward a touching left S1 nerve root after accident year. 2 neurosurgeons were against surgery, too small protrusion. What do I do?
Oh, so you have a small herniation and you're in pain. Come here to Deuk Spine, we'll fix it for you. You need this laser surgery, this will fix the problem. What I'd recommend is do the free MRI review. It costs you nothing. You just got to fill out a form. It takes 10 minutes. You know, it's going to ask you, do you have back pain? Do you have leg pain? Which leg? You know, do you have knee pain, hip pain, all that. You fill it out, and then you have to send us your MRI files, all your pictures. We've got to have those JPEG files. If we have your JPEG files, then I can look at your MRI and I could read what your problem is on your, you know, your questionnaire that you filled out. And then I do a Zoom call with you, and I meet you, and I spend 10 minutes with you, and I will tell you exactly what needs to be done and make sure you're a candidate for the laser surgery. So you don't even have to come to Duke Spine Institute to figure out if you could be a patient that would benefit from this surgery. Like literally 80% of the surgeries you're watching these days, these people come from out of state. They fly here, but they fly here after I do a Zoom call and tell them what's wrong and tell them how to fix it. Then they come here. So I don't know where you live, but all you got to do is do the free Zoom meeting with me. It's free MRI review. It's available to anybody in the world that wants it. We don't charge for that. You get one free meeting with me. You get my time for free.
And then, lastly but not least, our question coming from Essential Advantages once more on YouTube, asking, do you work on a lot of major sports players? Do teams use Duke for their surgeries?
Yeah, do I work? So the question is, does Duke Spine Institute work on a lot of major sports players? The answer is we do some, but not a whole lot, just because people still don't know about us. And we don't market. We just do these live streams and videos, and that's it. We have a website, but we don't spend money on pay-per-click or Facebook or any of those. We used to a long time ago, and it just wasn't very helpful. You know, we didn't get a lot of patients, so we just said screw it, save the money and buy equipment instead. So we bought some lasers and we have fluoroscopes. So we have equipment now and good people. Like I gave people better money. So rather than squandering the money on marketing that's just stupid, it doesn't work. So the point I'm trying to make is we get our patients by word of mouth, and we don't do a lot of marketing. And unfortunately, if you want to be the surgeon for a team these days, like the last 30 years, you have to pay the team to be the surgeon. I would have to pay the Miami Dolphins, I'd have to pay them $250,000 a year to be their team neurosurgeon. Yes, that's how it works. All the team doctors you see on the news, anywhere, they all pay 100%. There is no such thing as a team doctor who doesn't pay. It is a gimmick. They could be the worst surgeon in the world. And if they pay $250,000 to the Miami Dolphins, they will be the Miami Dolphins surgeon. I'm using the Miami Dolphins as an example, but it's true for all professional sports teams. There are so many surgeons and doctors that want to be their team doctor just so they could say I'm the team doctor. That they're not stupid. These teams are like, shit, if pay us $100,000, you can be our team doctor. And they take the $100,000, and then the next guy that comes along, they're like $150,000, then $200, then $250, then $300. Honestly, I don't even know what the going rate is today. When I looked into it, it was like literally 18 years ago. And 18 years ago, it was $150,000 to be a team doctor for like the Orlando Magic. So after I heard that they pick surgeons and doctors based on who pays the most, I realized this is not something I want to do, because there's always people out there with a lot more money than me that are going to outcompete me on money. So I just figured, screw it, it's not worth it. So do we operate on athletes? Yes, we do. Who are they? I can't tell you. But we haven't operated on Tiger Woods. We haven't operated on Elon Musk yet. We will. You watch. Elon Musk is pretty smart. Elon Musk, when he needs his second or third surgery on his neck, next disc, he's going to need it soon. You see, he's going to find us. He'll be here. And I'm going to make him do a commercial. He's a good guy, though. I mean, I know a lot of people hate him out there, but I don't think there's anything wrong with Elon Musk. I think he's got a good heart. He's a good businessman. He's not a bad person. I'm not saying he's a great benevolent person, but I think he's smart enough and techie enough that he'll find us. He's not stupid. And so you may see Elon Musk someday under the knife. You may see other famous people. Okay, let me put it to you this way. You will see famous people under the knife here. I'll be there. You will see famous people under the knife at Deuk Spine. It is 100% guaranteed in the future. Why? Because this surgeries that we do are so advanced and so much better than any other spine surgery that famous, powerful people will find out and will come here. We've already had billionaires come here and have surgery. We've had professional athletes come here and have surgery. I can't tell you who they are, but you've probably watched their surgeries. You wouldn't even know it. We have judges, we have lawyers, we have very, very famous people that come here. But, you know, I'm not bragging here. I'm just telling you that we do. And since you brought it up, that's the only reason I'm mentioning it. But it's a no-brainer. If I needed surgery, this is what I would do. You know, these other types of procedures are so invasive and dangerous that everyone's going to realize sooner or later there's a far better option. Okay, if you go to a buffet and you go to a buffet like a potluck, right, at work, and you open up some of the food and you're like, we got rice and beans, we got, you know, jambalaya, we got mac and cheese, we got filet mignon, right? I guarantee that filet mignon is going to be gone the fastest. Why? Because people are smart. They're not dumb. They know a good deal when they see it. And this surgery that we do here is amazing. We're the only place that literally comes out and says, we will cure your back pain and neck pain with our treatments. Because nobody else can. That's why they can't say it. They will never say it until they can. And right now, nobody else can. We say it with pride because we've done it thousands of times. We know exactly how to do it. So anyway, that's it. Any other questions?
Yes, we have one more question coming from Brad once more on YouTube, asking regarding Schmorl's nodes, are there cases where these get severe enough that they require surgery?
Yeah, Schmorl's nodes 100% never need surgery. I would never recommend Schmorl node surgery to anybody, okay? So folks, there's a couple of things that are found in the spine that never, ever, 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 ever need treatment. All right, remember these things. Do not let anyone operate on you for these reasons. Number one, Schmorl's nodes. Why not? We're talking about it. What is a Schmorl's node? A Schmorl's node is where you look at the MRI and some of the disc material, the herniated disc material, it isn't really a herniation, but instead of going forward, sideways, backwards, it actually goes into the bone. So it either goes down or up into the bone. And it's not really a herniation. I think people are born with that, to be honest, because it never causes symptoms. So you don't need Schmorl's node surgery. The next one is something called the Tarloff cyst, okay? Tarloff cyst. And it's basically a small cyst. The other name for it is perineural cyst. You might have heard of perineural cyst, Tarloff cyst. Tarloff cysts are a little bigger, and they're basically a weird, like, dilatation, enlargement of a sac around the nerves. Never, ever, ever do they cause problems, ever. And yet there's doctors that will operate on them. It's crazy, okay? So Tarloff cyst and this, what is it called? He just asked.
The Schmorl's node.
Sorry, Schmorl's node. I'm having a brain fart. And then what else? The hemangioma. So hemangioma, Hemangioma, see it all the time on MRIs. It is totally benign little blood vessel tumor in your bone. Don't freak out, tumor. Tumor just means mass. It's really like a hemorrhoid of your bone. And there's absolutely zero treatment for it. Now, small number, like 1 in 1,000 will become cancerous. For that, you need treatment, but not for the regular hemangiomas, okay? I hope you understand that. Anything else?
Yes, last question from Brad once more on YouTube, asking, what are your thoughts on disc seal?
Disc seal, Brad, come on. Brad, all right, disc seal. Disc seal, one word, Garbage. Doesn't work. It's a scam. They want your money. They want the insurance company's money. It doesn't work. We have had hundreds of patients come to Deuk Spine Institute with back pain, neck pain, that had disc seal procedure done, and it doesn't work. It just doesn't work. And when you ask them, did the disc seal help you at all? No. It might have made it worse. All right? About half of them say it made it worse. The other half say it didn't help. It doesn't work. It's sure, disc seal, right? Sounds good, right? Just like this word called nirvana sounds good, right?
Yeah.
Nirvana,
Yeah.
right? It's like everyone wants to reach nirvana.
Yeah.
Good luck. If you believe disc seal will help you, then I'll sell you nirvana. All right? It's like, selling a dream. There's lots of things that don't work. Don't be so surprised. There's so many treatments out there that do not work, and disc seal is another one. I would not do a disc seal. You can, but you take risk, right? So the risk is infection of your disc, and I've seen infections from disc seal, okay? There's always a risk of nerve damage from the disc seal. I've seen nerve damage, not me, I didn't do it. I don't do disc seal because I've seen so many problems with it, and it doesn't work. I don't think I've ever met a patient. I've never met a patient that said they did disc seal and it works. Never, ever, ever met a patient. And I've met hundreds upon hundreds of thousands of people with back and neck pain. So, I just think it's a scam. All right?
That is it?
We're going to be back in, looks like 10 minutes because they're ready for the next surgery. But we're going to start with the Deuk laser disc repair, L5-S1, and then a piriformis relays.